We continue our conversation on men's mental health. Last week we talked with Christy Buck with Be Nice and Eric Hipple, a former Lions quarterback, and he shared his story about his mental health struggles over the years. And today we have Michael Nanzer, CEO of Forest View, a mental health clinic. Thank you for being here with us.
Thanks for having me.
So just talk about what are some of the unique challenges men face when it comes to recognizing and addressing mental health issues?
I think one of the biggest challenges men face is the mental health system is really not set up for men. I always like to use the example, you take the stereotypical man working in a construction field or some sort of blue-collar job, and then you ask him to come into a room and be vulnerable and share his feelings. It's not that appealing, and it makes it much more hard for them to come in and seek treatment. So I think one of the things we really got to focus on in the mental health community and what we're seeing some benefit from is lowering those barriers, making it a little more man-friendly, so to speak, to help reduce that stigma. But some of the barriers it's the stigma associated with it. A lot of men feel that if they go to seek mental health, it's a sign of weakness. It's a sign that something's not right. I'm not the pillar to support my family anymore because I can't even take care of my own mental health. There's a lot of negative aspects that are particularly prevalent in men, and it manifests very differently in men as well.
Mm-hmm.
So,
talk about those factors contributing to men's mental health, the signs and symptoms.
Mm-hmm. Yeah, so some of the common symptoms you will see with just about everyone, but probably even more so in men. Decreased appetite, increased sleeping is a big one. Isolation is a very common thing, especially with men. It's the old stereotype. Women want to talk about the issues, men want to walk away and think about the issues. So you tend to see that a lot more with men as well. But it also manifests different. Men, you tend to see more irritability, anger issues. You tend to see more control-related things, more controlling behaviors, and then ultimately at the later stages, you tend to see more substance use disorders associated with it than you would with women.
Treatment options. Walk us through that. What does that look like?
Sure. There's a huge variety, and that's one of the things that I think people are afraid of. If they seek treatment, they're going to go into an inpatient facility. That is not the case. There's all different levels, and the way it's set up is that we line people up with the level for them. So the highest level is inpatient treatment within a facility like ours. On average, they're there for about 10 days, and then they're off to a more appropriate treatment. We have day treatment called partial hospitalization, where they can spend a week or two just coming in for the day, then they're back home in the afternoon. We have IOP, individualized programs, 3 times a week, about half-day long treatments. We have a med management clinic, so they can get services through their own therapist, their own psychiatrist, and then we can assist with managing their medications on that. And then probably the one that I think can make the most difference right now are support groups and community-based foundations. There are some out there that are specifically for men now that are starting to spring up. And I think that sort of thing it's a good introductory way. If they don't know anything else, getting involved in a male support group can be incredibly helpful.
What are you seeing right now? Are more men reaching out for help?
Since COVID, yes. But I will tell you, it's still very concerning just because of the data around men's mental health and how severe it is. So yes, since COVID, we've seen a lot more people seeking treatment. It is still nowhere near enough. I mean, the statistics are still men are 4 times likely to commit suicide compared to women. 80% of completed suicides in the U.S. are men, most of those middle age. So there's still a huge gap between what we're seeing as far as people seeking treatment and then the end effect of it actually having an improvement in the community.
How do you get men to seek help who need it?
I think peer support is one of the biggest things. One of the things to realize, like they've done a survey recently, 77% of men have had some sort of mental health issue that they've dealt with. And that's pretty much everyone, if you look at it. But only 40% of them are 40% have basically said they are not going to seek treatment. So that means the vast majority of people are still not interested. It's the stigma, they're afraid of how they're going to be perceived among their family, among their friends. But I think that peer support is one of the biggest things. If you get involved in a male support group, you get involved with some other male-focused groups in the community, you realize it's not that uncommon. It's not a sign of weakness to go and get help. It's not a sign of you're less of a man because you have an issue that you have to deal with. It's just same as any other medical condition. We get help when we need it, otherwise we're not there to support the people who need us.
Yeah, we'll be talking more about support groups next week. Anything else that you wanted to share?
I think the biggest thing, people need to reach out, okay? This can happen to anyone. Mental health doesn't discriminate. Anyone can be a victim of it. And anyone can be very successful getting through it as well. We just have to reach out and get the right supports. So if you're even concerned about it, if you have a family member that you're seeing changes with, the men in your life are showing these changes, get them connected to someone who can get help. And if they're not happy with the group they're in, find one that works for them, because one of the biggest things for long-term success is having a peer group that they identify with and they can stick with over a longer period.
Great. Thank you so much for being here with us.
Absolutely.
And we continue this conversation on men's mental health next Monday. A man from Gilda's Club, he shares his story of grief and the challenges he faced as a man needing support.